everyone, welcome to my another video. Today we discuss about most important MCQ for upcoming NORCET 2023. This is part 8. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 71. Which relationship is of most concern to the nurse because of its importance in the formation of personality? Option A, peer, B, sibling, C, spousal, D, parent-child. Right answer is option D, parent-child. Children view their own worth by the response received from their parents. This sense of worth sets the basic ego strengths and is vital to the formation of the personality. Peer groups come later in a child's development, but the parent-child relationship is still the most important. Sibling is important. It is not as important as the parent-child relationship. Spousal comes later in life after the basic personality has been formed. Next question. A nurse encourages a client to join a self-help group after being discharged from a mental health facility. What is the purpose of having people work in a group? Option A, support, B, confrontation, C, psychotherapy, D, self-awareness. Right answer is option A, support. Self-help group members share similar experiences and can provide valuable understanding and support to each other. Although confrontation may occur, it is not the primary purpose of self-help groups. Self-help groups provide an opportunity for people to interact, not engage in professional psychotherapy. Next question. A nurse is caring for an older adult with a hearing loss secondary to aging. What can the nurse expect to identify when assessing this client? Option A, dry cerumen, B, tears in the tympanic membrane, C, decrease of hair in the auditory canal, D, overgrowth of the epithelial auditory lining. Right answer is option A, dry cerumen. Dry cerumen or earwax becomes drier and harder as a person ages. There is no greater incidence of tympanic tears caused by the aging process. The hair in the auditory canal increases, not decreases, and the epithelium of the lining of the ear becomes thinner and drier. Next question. Amlodipine is prescribed for a client with hypertension. Which response to the medication should the nurse instruct the client to report to the healthcare provider? Option A, blurred vision, B, dizziness on rising, C, excessive urination, D, difficulty breathing. Right answer is option D, difficulty breathing. Dyspnea may indicate development of pulmonary edema, which is a life-threatening condition. Blurred vision may occur in some people, but it is not life-threatening. Excessive urination and dizziness on rising is a common side effect of this medication, which is not life-threatening. Next question. which is a frequent finding in clients with paraphiliac sexual disorders. Option A. Other covert or overt emotional problems. B. Gonadal and pituitary hormone deficiencies. C. Over-association with society's fringe groups. D. Inadequate development of the sexual organs. Right answer is option A. Other covert or overt emotional problems. Clients with these sexual disorders usually have many other emotional problems that may be overt or covert in nature. There is no proof of a deficiency of gonadal and pituitary hormones. There is expected development of sexual organs in individuals with paraphiliac sexual disorders. Next question. What should a nurse conclude that a client is doing when making up stories to fill in blank spaces of memory? Option A. Lying. B. Denying. C. Rationalizing. D. Confabulating. Right answer is option D. Confabulating. The individual is unaware of gaps in memory and therefore uses stories in an attempt to deny or cover up the gaps. Next question. Which nursing action is most important when caring for a client after a cardiac catheterization? Option A. Provide for rest. B. Administer oxygen. C. Check a pulse distal to the insertion site. D. Assess the electrocardiogram every 15 minutes. Right answer is option C. Check a pulse distal to the insertion site. The pulse should be assessed because the trauma at the insertion site may interfere with blood flow distal to the site. There is also danger of bleeding. Rest is not priority, although the extremity in which the catheter was inserted usually is immobilized for a period of time to prevent bleeding at the insertion site. Oxygen administration is determined on an individual basis. It is not routine. The client will be on a cardiac monitor which will allow for continuous monitoring. Next question. What must the nurse determine before discontinuing airborne precautions for a client with pulmonary tuberculosis? Option A. Client no longer is infected. B. Tuberculin skin test is negative. C. Sputum is free of acid-fast bacteria. D. Client's temperature has returned to normal. Right answer is option C. Sputum is free of acid-fast bacteria. The absence of bacteria in the sputum indicates that the disease can no longer be spread by the airborne route. Treatment is over an extended period. Eventually, the client may not have an active disease but still remains infected. Once an individual has been infected, the tuberculin test will always be positive. And there is no evidence that if a client's temperature has returned to normal, then the disease cannot be transmitted. Next question. A nurse is administering oxygen to a client with chest pain who is restless. What method of oxygen administration will most likely prevent a further increase in the client's anxiety level? Option A. Cannula. B. Catheter, C. Venturi marks, D. rebreather marks. Right answer is option A. Cannula. Oxygen via nasal cannula is the most comfortable and least intrusive because the cannula extends minimally into the nose. Catheter is intrusive and it may increase anxiety. Venturi marks and rebreather marks method is oppressive and clients complain of feeling suffocated when it is used. Next question. When an intestinal obstruction is suspected, a client has a nasogastric tube inserted and attached to suction. For what response should the nurse critically assess this client? Option A. Edema, B. Belching, C. Fluid deficit, D. Excessive salivation. Right answer is option C. Fluid deficit. Dehydration is a danger sign because of fluid loss with GI suction. So this is today's video. Thank you so much for watching my video.